What is androgenic alopecia? Alopecia is a Greek word that means baldness, and androgenic alopecia means baldness resulting from the activity of androgens. What are androgens? Androgens are hormones that are present both in males and females and are responsible for development of various characteristics. Now, what these androgens do, they go and they attach themselves to the receptors present on the terminal hair follicles. In my 15 years of practice, androgenic alopecia is the most common problem that I see in my clinic every day. Mostly men suffer from it, although females also suffer from androgenic alopecia. Males may start around the age of puberty and reaches its maximum around by the age of 40. In females, the onset is late and it starts around the age of 40. Females can also have symptoms like acne, hirsutism, and irregular menstrual cycles, which can be a sign that the patient is suffering from androgenic alopecia. The pattern is different for both males and females. Males, there is thinning of the frontal hairline and there is bitemporal recession along with vertex. Females, normally their hairline is not disturbed, the density is reduced and there is a diffuse hair loss throughout the scalp. The cosmetic appearance of androgenic alopecia can be very disturbing owing to the high value that a society places on a healthy head of hair. So how can you know that you're suffering from hair fall or you're a patient of androgenic alopecia? There is a very simple test known as the hair pull test. The scalp hair are gently pulled, and if you see 3 to 5 strands of hair every time you pull your scalp, then there is some pathology and you need to go and see your doctor for further evaluation. Although there is no one solution for androgenic alopecia, but there are methods by which we can delay and buy you time. So the most popular topical treatment that I give in my clinic and also is prescribed around the world is minoxidil. It comes in 2 strengths, 2% and 5%. It is applied topically. The patient should not vigorously apply on the scalp. It should be sprayed on the scalp and gently massaged. One should not use more than 2 ml in a day. The onset of action is a little slow, so you have to wait for 2 to 3 months before you can see any good results. The basic mechanism of action of minoxidil is that it increases the blood supply of the hair roots. An increased blood supply means more nutrition, more blood, resulting in a healthier root and a healthier hair. Side effects usually are not very common. Side effects include irritation and there can be a slight level of dependency. That means that you have to keep using it to get the results. Finasteride is another very good and popular drug used around the world. It's given orally and it's given in 1 milligram per day dose. The results also start to show a little slow, so you need to keep taking it for at least 3 months. The results are very good. Once they appear, the hair comes back, the line comes back, and the patient is really satisfied. And the results can persist for up to a year after even after you have stopped taking finasteride. So it's a very good treatment, and we give in combination with minoxidil. So I give both finasteride and minoxidil in combination for 3 to 6 months, and the patient is quite happy. Platelet-rich plasma therapy, in short we call it PRP, is another very popular treatment these days. What we do is we take out the blood from the patient and we extract the plasma out of it and we inject that platelet-rich plasma directly into the scalp. The results are variable. Some people get very good results out of it, and for some the results are slow and may not be sufficient. So we sometimes mix it with the oral treatment to give the best results for the patients. Now I'll tell you a little bit about the latest treatment which is very popular in the market, and that is stem cell hair restoration therapy. Grafts are taken from your neck, and these grafts are then processed and stem cells are extracted out of it, and those stem cells are then injected directly onto the scalp. The good thing about this treatment is that you may not have to repeat it for 2 to 3 years, and the results are better than PRP and oral treatment. So it is also another option these days in the market. Finally, people who have lost hair, people who have lost more than 80% of their hair transplant is the ultimate solution.